Hi everyone, my name is Jamie, and today I wanted to do a presentation on lower economic communities and the quality of care. So, healthcare is defined as the maintenance system and the improvement of physical and mental health through the provision of medical services. This is defined by the Merriam-Webster Dictionary. Having access to healthcare should be very universal, and it should essentially be top tier due to the importance of everyone's life. Unfortunately, that is not always the case. According to the CDC, those who frequently have delayed and or do not even receive healthcare in general from the adult age group, which is 18 to 64, is nearly 30%. Even worse, those who live in lower SES or lower socioeconomic communities in the United States face an epidemic where access to healthcare is available, but the quality of care is truly not the best it could be. The quality of care is essentially not up to par and could be the reason why these lower socioeconomic communities may be suffering because physicians in general and the healthcare system is set up in a certain way where it actually affects their health negatively. According to Healthy People 2020, 3 things that affect the quality of care is the type of coverage, the timeliness of the care, and the services that are provided to those in the community. Coverage through healthcare systems can negatively affect the poor health statuses due to the lack of the medical care. Late diagnosis and the lack of diagnosis are also things that negatively affect those. And these are factors that essentially can lead to a premature mortality. Timeliness plays a big role in the way the system should be. Timeliness includes things such as attending to patients quickly and addressing their needs in a way where they feel safe and they feel like their situation is being cared for. This may be conflicting because not all healthcare providers actually work in that way. A lot of them have a tier system where they rate the essential need for someone, and it kind of deteriorates someone's own perspective on their pain. Services also need to be improved because the quality of care is not always the best. The services from the doctors are not always in the best interests of the patients either. But it's for the doctors. Doctors are perceived as these good guys in the healthcare system, but essentially sometimes their intention is to create the most profit in terms of what they can provide you through their services. Preventive services such as clinics, emergency rooms, and hospitals sometimes show a lack of a basic need. Decreasing life through these predisposed morbidities and premature mortalities is always a huge risk factor in these lower SES communities. Looking at it in a geographic point of view, lower socioeconomic status and race ethnicity play a big role in the opportunity to getting health care. Those who identify as white are actually more likely to travel over 20 miles to receive the care they need. Those in higher density populations, those who are basically living where it's more people and less hospitals, or even if there are hospitals, they are overcrowded and they can be essentially far to get the better care. Those who are living in those higher density populations are less likely to take the time to travel to a hospital that is probably best fit for them. The distance and the access, and even the time it takes to get there, create a huge health disparity for racial minorities. In this specific situation, one can hope to find a solution in which can eliminate this problem and eliminate the financial barriers that reduce the prevalence of the health disparity itself. It is important to create more clinics with better care, understanding that this better care for these patients and these communities can create less predisposed morbidities and premature mortalities for them. And those with the appropriate equipment and the most knowledgeable and understanding physicians can also create a destruction to the financial barriers that come with those who are they're not really this top tier coverage. The greatest escape fire to this entire problem would be the possibility of creating a world in which the considerations of each and every person is taken. I know that sounds pretty hard, but I think this is really essential in order to personalize and understand the background of each person and where they're coming from. It is something that may be greatly affected by the politics of the government and the healthcare system setup, but it truly may be the best idea. From an article written by Kagavi et al., state that the understanding of the various disparities that a person faces and creating the best solution to both their physical and their mental health is important, but also understanding what is the most affordable and best fit for them. It is truly something that should be ultimately universal for everyone in this nation, just because it's hard to understand and hard to really create something that's universal, that's one size fits all. Those who live in lower SES communities are presented to the healthcare system for failure. They are undertreated and they are not presented with the best and the most affordable care for themselves. Allowing those to speak up and then unravel the complexity can help those who are in need and get the quality of care that they truly do deserve.